The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Today is April 21st, 2023. I'm Donna Will, Professional Development Coordinator for the Central Maryland Regional Office of the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the Appendix K Unwinding webinar. On the panel today, we have Bernie Simons, Deputy Secretary for DDA, Robert White, Director of Operations, Rhonda Workman, Director of Federal Programs and Integrity, Nova Evans, Deputy Director of Federal Programs and Integrity, and Nick Burton, Director of Programs. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone, and if you look at the panel interface on your right labeled audio, you can click either computer or phone for the best option. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's presentation has also been uploaded as an attachment and is available for you to download from the handout section in the webinar panel. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Bernie Simons. Good afternoon.
Good afternoon, and I want to thank everybody for joining us today as we share our information regarding the unwinding of the Appendix K flexibilities that have been applied to the DDA waivers. Over the past few years, collectively, we've been able to support individuals, families, direct support professionals, providers with various state orders, and Appendix K flexibilities and enhance federal funding and grants. So the department met regularly with the DD Coalition to discuss strategies and timing for the unwinding of the DDA Appendix K flexibilities. And since August 2021, the department has been slowly unwinding as we resume some services and operations. So having said that, I would like to thank the DD Coalition, the members, and recognize them as People on the Go, the ARCA Maryland, Disability Rights Maryland, the Maryland Association of Community Services, and the DD Council for their support and partnership in these discussions and this effort as we move forward. So as previously shared in our webinars and guidance posted on our website, the Appendix K remaining flexibilities end on June 30th, 2023. That's this year. And so we've incorporated several of the Appendix K flexibilities into our waiver programs through previous waiver amendments. So we've adjusted to include those. We've adjusted the waivers, and also with our waiver renewal proposal. So many of you know that our waiver ends on June 30th of this year. So I'm happy to share with you today that our waiver renewal has been approved by the Center for Medicare and Medicaid Services. That's effective July 1, 2023, and will incorporate many of those other flexibilities into that waiver. And so with the approval of CMS, we're good to go. So we'll continue to provide regular communications and reminders about the unwinding of Appendix K and the implementation of our waiver renewals. And so for today, many of you know Rhonda Workman, the Director of our Federal Programs, and she's going to review the flexibilities ending and share with you in charts. And again, as Donna said, this PowerPoint presentation you can upload or download, I guess, since it's in the available for you. And so we want to share these flexibilities that have made permanent into our ongoing waiver effective July 1st. So next slide, please.
Thank you, Bernie, and good afternoon, everybody. My name is Rhonda Workman. This slide includes a chart with the remaining DDA Appendix K flexibilities, and they relate to the following categories: funding and retainment payments, hiring and training requirements, service flexibilities, staff ratios, and self-direction. Under the funding and retainer payment flexibilities, we have flexibilities related to meaningful day, personal supports, and residential retainer payments, an increased rate due to the need for the person to be isolated, residential daytime shared service hours, and the suspension of the minimum number of hours of meaningful day services to be provided in a single day. A provider may bill for the entire day only if the person has received a minimum of 3 hours of cumulative supports. Under our hiring and training remaining flexibilities, that includes waiving all but essential training, having an expedited format for our policy on reportable incidents and investigations, sharing staff among providers, CPR and first aid exceptions in terms of how they're being provided, the training, suspension of the MANT training, waiver of high school or GED requirements, an annual training requirement extension so that previous direct support professionals who had previously completed all requirements less than 18 months ago could continue to provide services, and hiring relatives and legally responsible individuals. Under the service flexibilities, that includes being able to provide services any day of the week, exceed an 8-hour-a-day limit, and also exceed the 40-hour limit per week within the person's authorized budget. In terms of the staff ratio flexibilities, that includes exceeding the maximum community development service group size and 1-to-1 and 2-to-1 staffing ratio exceptions with the approval of the DDA regional office. And under our self-directed services, the remaining flexibilities include budget modifications without prior authorization and flexibilities related to support broker services, including being able to be provided up to 20 hours per month, and support brokers also providing other waiver services that are needed. These flexibilities, as the Deputy Secretary has shared, will be ending on June 30th, unless otherwise noted in the DDA waiver programs or guidance. Next slide, please. This slide lists the flexibilities that will remain permanent under the DDA programs. They include residential retainer payments, meaning 18 days per calendar year, residential daytime shared service hours, as per our current policy that's available online, meaningful day services being able to be provided any day of the week, which was noted in our waiver renewal proposals, employment services ongoing job support hours per day, meaning being able to exceed those 8 hours, which was also noted in our waiver renewal proposals, waiver of high school or GED requirements for specific services that we'll be reviewing on the next slide, hiring relatives and legally responsible individuals for specific services that we will also review on an upcoming slide, and self-directed budget modification flexibilities as noted in our guidance associated with the financial management and counseling services. It's important to note and to refer to the approved waivers and DDA guidance for additional information and our requirements associated with these flexibilities. We will be updating our guidance and policies based on the CMS approval of the waiver renewal. Next slide, please. This slide includes a chart that notes the DDA services for which a person, self-directing services, and providers can continue to retain and hire relatives and legally responsible individuals. During the public health emergency, people self-directing services and providers were able to hire relatives and legally responsible individuals to meet those immediate staffing needs. In the DDA approved waivers, a relative is defined as a natural or adoptive parent, step parent, or sibling who is not also a legal guardian or legally responsible person. Our new proposal included relatives proposal to add child and stepchild of the participants. Also, parents of minors can also provide support during service delivery due to extraordinary care circumstances. A legally responsible person is defined as a person who has a legal obligation under the provision of Maryland law to care for another person. Under Maryland law, this includes a parent, either natural or adoptive, legal guardian, or person otherwise legally responsible for the care of a minor. The DDA expanded these service flexibilities for which a relative or legally responsible individual can be hired to provide services in our waiver renewal proposals. So you see the list here. And we again suggest that you refer to the approved waiver and policies and guidance related to any additional requirements associated with hiring relatives and legally responsible people. Next slide, please. Also, during the public health emergency, people self-directing services and providers were able to waive the direct support professional qualification requirement for a high school or GE requirement. This slide includes a chart that notes the removal of the high school and GED requirements for some services so that people self-directing services and providers can continue to retain and hire individuals who do not have a high school diploma or GED for community development services, community living group home services, employment services, personal supports, shared living, supported brokers, supported employment, supported living, and transportation. Next slide, please. The DDA waiver renewals also include the flexibilities related to service delivery. And as I've shared before, this includes the option to receive all meaningful day services any day of the week. And for those employment services, ongoing job supports will be able to be provided more than 8 hours a day and work more than 40 hours a week to support people who are working overtime and have that opportunity to make additional income. These flexibilities again go into effect July 1st, and we will update our guidance, policies, and also working on updates to the LTSS Maryland system to support these new flexibilities. Next slide, please. Today, we also wanted to share some additional information as we are unwinding certification and trainings flexibilities that we mentioned earlier, completed prior to July 1st, 2023, regardless of modality, meaning how they were provided, are good until they expire. This means if the training was provided virtually, it does not have to be redone in person until the expiration date. In terms of retainer payments, we recently shared communication about the flexibility to access both the Appendix K and Community Pathway Waiver residential retainer days. When Appendix K retainer payments are requested, the provider must meet the federal Appendix K guardrails. Additional information is available on the DDA website. If only Community Pathways residential retainer days are requested, the provider does not need to meet the Appendix K guardrails. Next slide, please. We also wanted to share with you today that the DDA has been working with stakeholders on a new training matrix resource tool. The draft training matrix is categorized by required trainings, broken down by audience, competency-based skills and knowledge, resources, and references to the specific rule or federal authority. We plan to release this training matrix by June 1st and appreciate the support and collaboration we are receiving from groups we have reached out for input. Next slide, please. We also wanted to share some updates today related to the Policy on Reportable Incidents and Investigation training. The DDA is developing PORI training that will be available for providers to use July 1st. It's important to note that this training is just a resource. It will not be required. At a minimum, providers should know how to identify and report incidents per the PORI policy. The DDA will also share a PORI training geared towards participants and families. Next slide, please. We also wanted to share several of the self-directed service budget modification flexibilities that are available. They include staff-related cost flexibilities, such as increasing or decreasing staff wages or vendor provider rates within our reasonable and customary standards. Additions, increases, decreases, or deletions of employee-related expenses, such as health benefits, paid time off, sick and safe leave, training, and transportation. Adjustments to funding associated with taxes. Also changing the use of a staff to a vendor or provider for the same type and unit of services. Changing the use of a vendor or provider to hiring staff. And funding allocation for backup staff for services authorized on the person-centered plan at the same level. There are also service-related flexibilities, such as increasing respite camp funding up to the waiver program service limit, and moving funding associated with employment services, ongoing job supports, community development services, and rehabilitation services to increase or add to employment services, CDS, personal supports, and DAHAB. Again, it is important to note that all modifications must be within the approved budget and to refer to any additional DDA guidance and requirements. Next slide, please. As the Deputy Secretary shared, the DDA will be sharing regular communication reminders regarding the unwinding of the Appendix K flexibilities we talked about today. We will also be sharing additional information regarding the waiver renewals. It's important to receive our communication about updates that you consider joining the DDA mailing list for updates. To do this, simply click on the link in your handout, and that'll take you to the form to fill out. Next slide, please. This slide includes contact information for our regional office directors. So if you have questions or concerns or need assistance, please reach out to them directly for person-specific needs. Next slide, please. This slide includes contact information for people at the headquarters office, including Nick Burton, our Director of Programs, Christy Colbreth, the Statewide Coordinator of Self-Directed Services, Nicolette, our Director of Coordination of Services, and Leslie, our Director of Provider Services. Next slide, please. So now we're happy to take questions.
Thank you, Rhonda. I'm going to take these questions we have on our chat box. So the first one is, you mentioned the continuation of hiring family members when other direct support professionals cannot be found in relation to personal supports, but did not mention supported living. Will this flexibility be available for someone who has supported living services?
Yeah, so hiring relatives and legally responsible individuals on our chart, you will see we do list supported living, and so you can hire a relative for supported living.
Great. And then the next one is, can you clarify the minimum number of service hours needed per day in CDS DAHAB to bill for in PCIS?
Yes, so with the service flexibility ending, the regulation requires 6 hours of service billing. There are some uniqueness there where a lesser amount of hours can be authorized by the DDA and the PCP in the plan, in the person-centered plan.
Great, thank you. So the next question is, can a legal guardian be hired as staff under self-directed services?
Yes, legal guardian, there are provisions for legal guardian to be hired as staff. The flexibilities that we have in place related to hiring relatives and legally responsible individuals, but the waivers do provide flexibility based on the services for legal guardians to provide services.
Great. And then the next question is, can day CDS hours be provided any time of the day or week?
Yes, day habilitation and community development service hours can be provided any time and day of the week. Currently, community development services can be provided any day of the week. Day habilitation flexibility is available under Appendix K now and will continue July 1st with the approval of our renewals.
So then this says, the slide that said there's a new DDA PORI training is just a resource but not required. I'm not sure if this is for you, Rhonda, but the question is, doesn't Liberty require a number of trainings to be submitted for their utilization reviews, including PORI training?
Yeah, I'll let Nick answer that one.
Yep, thanks, Rhonda. So the question really is the DDA PORI training requirement. We said it's a resource, not a requirement. And then the question was, well, Liberty's requiring it. I think there's a distinction we want to make regarding the DDA PORI training. So DDA has always had a PORI policy, right? But DDA has never had a PORI training, quote unquote. We are developing a training and you can utilize it for your team, for your agency, but you're not required to. What you are required to be able to do, and this is what's being held accountable to, is ensuring your staff, right, depending on what level they are in your agency, know how to submit an incident, report an incident, right? So DSPs knowing how to report an incident, and then likely oftentimes your QE staff knowing how to submit an incident report through the PORI process. And so that is the requirement, knowing how to do those things. Our training that we're developing and that will be available to all of you will outline all of that, but I know many of you have incorporated the PORI policy requirements into training that you already have. And as long as it continues to meet the requirements of the policy, you can continue to use those trainings.
Thank you, Nick. So this is a question, is high school diploma waived for day habilitation?
Yeah, great question. Currently, day habilitation does not have a requirement for the staff to have a high school diploma, so it doesn't have to be waived. It's not a current requirement.
And then someone here is asking about, will the webinar be available and downloadable?
Yeah, great question. So as Donna shared in our opening, the DDA will have the webinar, the recorded webinar available on our YouTube and also on the DDA website.
So this question is asking about, can you say more about plans for this project and if self-directed participants are going to be part of the pilot? I believe that's going to Nick.
Yeah, I think this is related to the training matrix, and we will have information on there for people self-directing minimal required training. Nick, do you want to add about the training matrix?
Yeah, sorry. Can you repeat the question though, Nova?
It says, can you say more about the plans for the project and if self-directed participants are part of that planning?
Yeah. So the training matrix is really an outline of required trainings, minimum basic required trainings for the different services that DDA has. So minimum required trainings for DSPs, for behavior specialists, for housing specialists. We outline those minimum required trainings, where those minimum required trainings are found in either rule or policy, and then some resources on how to meet those training standards or needs. Understanding that in a provider agency, many providers have trainings and have training curriculum that has been working for them that are meeting the standards and needs and can continue to use those. Also understanding that there are also people that are self-directing their supports who have engaged in training of their staff in a way that works for them, in a way that makes sure they understand the information on how to support them, and then also accessing other community resources such as, CPR, first aid, that can be offered in the community, or other resources as well. And so again, the matrix is really just, here's an outline of what's required and where to find it and some resources.
Thanks. This question might have been answered, but it asks, can a parent of an adult be hired in supported living?
A parent of an adult be hired in supported living. I don't think that that's an allowable under the supported living model.
This is a self-directed question. How do you account for overtime pay in a budget? What is the budget line?
Oh, what a great question. So I would offer that our self-directed service leads are available to assist with that. There's different components on the budget sheet. Christy Culberth, our statewide coordinator for self-direction, is also available so that we can pull that budget sheet up and show that with you and walk it through depending on which service you're looking at.
And then I believe this is in regard to Appendix K. Can a rep payee be hired as staff?
Yes.
The next one is, are virtual supports still included?
Oh, what a great question. So virtual supports were incorporated in our waiver amendment 3 that went in effect January 19th of 2022. So yes, those are available for specific services as outlined in the waiver.
No, but can I tag on to that in regards to the question that came in about in regards to CCS monitoring?
Go ahead.
Okay. So there was a question regarding people requesting to meet virtually in regards to required monitoring. So required quarterly monitoring is required to be in person. And we had sent out a memo regarding those requirements to be resumed in person, I believe in September, that states that that flexibility for monitoring is not in place. That monitoring needs to be, the quarterly monitoring requirements need to be in person, face-to-face, as per outlined in our rule and in the guidance that we sent out in the memo, I believe in September. I think the other thing just to keep in mind there is, there can be some flexibility there, right? It doesn't have to be at the kitchen table, face-to-face in the house. It can be based upon needs and preferences of the family. Someone may be sick, so maybe you can do something outside. Maybe you can do something in the community. Maybe you do something that month at their work site or their meaningful day site. I think it's really, a team needs to really have those conversations about flexibilities and what works for the family. And then also, I think it's another good opportunity for families to engage in this process is Marianne Kane-Bresci is hosting one of the family community of practice webinars about monitoring, and is going to have Nicolette, our CCS director, on the webinar to kind of talk about what monitoring looks like, what the monitoring requirements are, and how to engage in that process with your CCS.
Thank you. This one has says, Rhonda, you mentioned 6 hours for the minimum of CDS day have hours. They thought it was originally written that it had to be less than 4 hours per day. Can you clarify that?
Sure. So I think there's a couple things through the Appendix K flexibilities. We initially had a minimum of 1 hour being required in order to bill for the day. The current standard is a minimum of 3 hours provided. The DDA regulations will speak to 6 hours being provided, and there is a provision in there for lesser hours that could be provided as approved in the person-centered plan.
Thank you. This one has to do with a high school diploma GED requirement, ended September 2022. And now with the waiver renewal, it looks like it will also be waived. So the question is, between September 2022 to now, has that been waived?
So the requirement for high school diploma and GE requirements did not end on September 2023. They will end, the Appendix K will end June 30th. With the approval of the waiver, it allows them to continue then permanently.
This one says, what training in addition to CPR first aid is required from July 1st to provide personal supports, and where can we access this training?
Sure. So personal supports, CPR and first aid, criminal background checks are some of the requirements for staff qualifications. We have those qualifications noted, some in our policies and guidance. They'll be reflected in the training matrix. In addition, they are in the approved waivers. People's self-directing services can also require their staff to have additional training to meet their specific needs. And so that would be based on their decisions for that.
Great. There's a number of questions coming in about whether a person can hire a parent, family member, or legal guardian for supported living. And I think you touched on it, but maybe some clarification since we have so many questions.
Sure. So for supported living, we have that noted on our chart. Relatives can. I will pull up the actual waiver so I can speak directly to that and not misquote what we currently have available, Nova, so we can come back to that.
Okay. Okay, so this one is with the approval of the Community Pathway Retainer Days back to January 2022. Should providers submit error update reports to claim these days retroactively?
That's a great question. Robert, did you want to talk about error update reports related to Community Pathways retainer payments that are available now?
Sure, thank you, Rhonda. Yes, for providers who have not used any of the COVID, the days available through the COVID retainer days because of guardrails, or you've exceeded that number and or want to make changes, you would just work with your regional offices to follow the procedure for submitting error updates.
Thank you. This question asks, if CPR certification was done online, will it need to be renewed in person when it expires after July 1st, 2023?
Great question. So yes, initially with the public health emergency, you may recall it was very difficult for staff to be trained. So training, as noted under the Appendix K, could have occurred over the phone or in different methods. So based on what the national certification standards are for training, that's what you would apply and make sure that you have once the training has expired.
Great. I think this question's for Nick. Some people and providers continue to hold or request meetings and visits virtually, Will that continue after 6/30/23?
Yeah, so thanks for that question, Nova. We talked a little bit a moment ago about the required monitoring. So the quarterly required monitoring is required in person. I think another caveat to monitoring that CCS need to think about and use their best judgment is depending on issues that may come up. Maybe there was a recent abuse and neglect allegation. Maybe there was a non-compliant CSQ. Maybe the person moved. Maybe the person started a new job. You may make the determination that in-person monitoring is needed to really ensure that you have a good understanding of how the person's doing, satisfied with their supports, they're healthy, they're safe. That those types of monitoring could be in person, depending on the situation. They also could be done virtually if need be. I think the other important thing to remember is people, in regards to their person-centered planning process, many people choose to engage in their person-centered planning process in a way that works for them. It could be virtually, it could be over the phone, some of it could be via text, and I think it's really a team conversation to talk about what really works for the person. But I, again, want to remind people the 4 quarterly monitoring requirements are required in person, face-to-face.
Okay, Nova, to go back to the supported living question, I've pulled up the Community Pathways proposal that's online. Page 314 notes that a relative who is not a spouse, legally responsible person, or legal guardian who does not live in the residence in the supported living site may be paid to provide the service. If a legally responsible person, legal guardian relative lives in that residence, then they cannot be paid to provide the services directly or indirectly.
Thank you. Okay, this asks, can a parent of a minor care for a client, and can parents work over 40 hours a week?
Yeah, great question. So yes, parents of a minor can provide services. The waiver notes this in our Appendix C, and we refer to the provision of these services as extraordinary or above the normal services or supports that a parent would be providing. So you can refer to those details there. Parents and family members and relatives can provide more than 40 hours. They would need to be reviewed and authorized with the regional office, but yes, those are options that are available.
Okay. Next question is, can follow-along services be delivered as a virtual service?
Nick, do you want to address that one?
Sorry, yes, I was going to pull up the policy really quick just to make sure that I'm quoting it correctly. So can I request the same accommodation as Rhonda to go take a look at that, and then we can come back to it, Nova?
Yes, of course. Okay, so let's see. There's a number of self-directed service questions. Let me see. Can you, I'll do this one first. Can you explain the difference between virtual supports and remote supports?
Oh yeah, great question. So remote support services is a specific standalone support service in the DDA waiver program. And it's designed to support people who are seeking more independence in their home. So it could include hiring a remote support service provider who would be available, let's say like overnight. They could, teleconference in with someone, visual, have supports, backup systems if needed, but it's supporting the person to be more independent and utilize less direct staff so that they could access remotely assistance or supports from an agency that would be off-site. Virtual supports is a service delivery method that providers can propose to provide to support people with services such as community development services. So some of our meaningful day services and personal supports could be and have been provided virtually. Doing online classes and activities through different technology platforms so that people are learning and engaging in activities. If providers are offering virtual supports as a business model or method, they need to make sure that they have included that in their DDA program service plan. And so you can follow up with the regional office provider services. And if virtual supports method is going to be provided and offered, that needs to be communicated and shared with the participant during that person-centered planning meeting and should be approved, right, by the person that they're interested in that method versus in-person supports. And it should be incorporated in the provider's service implementation plan that would be provided to the participant and included in the plan.
Thank you.
Nova, I have the policy pulled up if you want me to clarify the follow-along question.
Absolutely.
Yeah, so I wanted to get the specific language. So for follow-along supports, there's a minimum of 2 face-to-face visits that need to occur, monthly support that needs to occur. Outside of that, you know, you can do phone calls, general coordination, those contacts that are maybe not direct, they can be those indirect contacts to ensure the person is continuing to be successful at their job. But there is the 2 face-to-face visits that do need to occur.
Okay, this is a kind of a clarifying question. This says you mentioned that relatives can be hired under supported living, but then seem to indicate a parent of an adult child couldn't be hired. Can you clarify?
Sure. So the clarification here is whether or not the parent, the relative, the family member is living in the supported living site. So the supported living is a service that is provides supports to people living in their own home or apartment, and supports are coming into that home for them. So if a relative does not live with them, then they can absolutely be hired to provide those services.
Okay, thank you. I think you answered these questions, so let me run down. Does the minimum CDS hours apply to self-direction as well?
No, because the minimum hours are really specifically associated with providers billing in the DDA Provider Client Information System, or PCIS. So providers billing in LTSS and people self-directing could provide less hours because they're billing on a basically 15-minute increment.
Rhonda, there was a lot of questions that came in about clarifying come July 1st, the minimum required for those that are still in PCIS 2. Can you help clarify that a little bit?
Yep. As I mentioned, the DDA regulations notes that the minimally 6 hours need to be provided. The regulations do note that there could be authorization in the person-centered plan for lesser than those hours based on unique circumstances.
Okay, let me see here. There's a bunch of clarifying questions that I think we already hit. Starting what day can the retainer payments, retainer days be used without the guardrails applying?
Great question. So there's different situations where a provider can use the community pathways retainer payments without having to do the guardrails. If you haven't requested or utilized any of the Appendix K retainer days, you can bill for the community pathways residential retainer fees today, and there would be no guardrails. The Community Pathways retainer days will reset every calendar year. So January 1st, they reset for another 18.
Thank you. What occurs if a provider says the house is, or the agency is shut down to visitors due to COVID or another outbreak? I'm not sure.
Yeah,
I'm
I
not
think,
sure about that question.
yeah, I would suggest if it's a home provider specific, to reach out to that agency. If you need additional assistance, reach out to your regional office.
Okay.
And Nova, I'm just going to add something. There continues to be a lot of questions in regards to meaningful day, employment services, PCIS2 minimum requirements. I think what we're going to do is Rhonda and I will work together with the DDA team to kind of put together a table so that it's crystal clear what those look like as we move forward with July 1. So that there's no ambiguity and there's no confusion about what the requirement is. So we will work on putting that together. Please go ahead and shoot me any questions regarding that so that we can hopefully continue to clarify that question for you. And we'll make sure that we take the questions here in the chat box regarding meaningful day, minimum requirements, employment, minimum requirements, regardless of PCIS2, and then what it looks like in our fee-for-service model. But we will do that. But I think just to limit confusion on a call for people coming in and going, we're going to just put together something and put it out there for everyone to see in one document. So
yeah, I think that's a great idea. There's clearly a lot of interest. Okay, let me see. Let's see here. Sorry, I'm just kind of getting through these because there's a lot of those meaningful day ones. This one is kind of a broad question, but it asks if you could define what guardrails mean.
Yeah, great question. So the DDA shared communications some time ago, a couple of years ago, related to the federal requirements for what they refer as guardrails. And so under the federal guidance and requirements that came out, and I'm going to paraphrase, so you can look at them directly. Basically, providers have to attest that accessing the Appendix K retainer payments, that they would not make more money due to the public health emergency than they would have otherwise if it didn't occur. And so it's a provision for funding that was to support providers because they were unable to provide services because we were shut down, an outbreak, the person wasn't coming to the program, the person went home to stay with their family instead of staying in their residential home. And so they were referred to as guardrails, and an attestation is required. On the DDA Appendix K webpage, we have information about retainer payments, and it also includes the attestation form. If you have additional questions, please feel free to reach out to your regional director who can help you with those.
Great. There's a lot of questions about where people can find this recording after and the materials. And I think we've mentioned that this will be posted to the DDA website, and we'll send out communication about where to find that in the weekly communications. Yeah, there's. Does a person self-directing their services have to specify if they're going to use virtual supports as part of CDS or personal support services?
Yeah, people self-direction or self-directing services also utilize service implementation plans. And so if that's the method that you would like to receive your supports, then you should have that outlined so that we make sure that you're getting the services and supports as you know, you're interested in and to meet your needs.
Great. Can you use 2 family members to provide supports in the Community Pathways waiver after June 30th?
Yes, so as we shared today, family members are able to provide a variety of services. It's not limited to only one family member, so you can utilize various family members to support you with the different service needs. Again, refer to our guidance in the approved waivers.
There's some questions, clarifications about residential retainer days going back to January 2022, and how providers are going to be able to go back and change billing attendance, even though the FY 2022 adjustments were already due. Maybe that question is for Robert.
Yes, Robert, did you want to refresh or add to the retainer payments question related to going back to January 2022?
Yeah, sure. So the Appendix K, in the Appendix K, the latest version, as Rhonda mentioned, we got retroactive approval to go back to January 1 of 2022 for use of the traditional retainer days, those 18 days. And so that's what, again, if for those of you who didn't get an opportunity to tap into that, that particular bucket, again, just work with the regional offices to complete error updates.
Okay, thank you.
If I see a question here about starting with day, I'm thinking that's day can retainer days be provided without the guardrails? Please note that with the ending of the Appendix K, retainer payments for meaningful day services and personal supports will end June 30th. The provision that's made permanent is the residential retainer payments, and that's 18 days per calendar year.
Great. So this question asks, excuse me, for agencies providing residential, vocational, and school services to individuals, are the direct support professionals exempt from the high school diploma requirement?
Yeah, so for that question, I would say we can only speak to the DDA waiver services. And as we've shared in our presentation today and noted in our waivers, those are the specific services for which those requirements are no longer going to be going forward. If you're providing school-related services or other services and other service delivery systems, we have no authority to exempt those requirements.
And this question asks, will the COMAR regulations 1022.17 be updated after Appendix K the Appendix K expires?
Yes, so we are coordinating with our Medicaid partners within the department, the Office of Long-Term Services and Supports, on the issuing of DDA's operated Medicaid waiver programs regs. In addition, we'll be looking at the DDA regulations, the 1022 and the Chapter 17 related to the billing.
Yeah. So there's a lot of questions here. I'm just going through because I think some of them were already answered. You might have answered this one, but let me ask again. Will both day hab and residential be able to bill at the same time for day hab services in the PCP with some of the day hab providers being virtual? I'm not quite sure. Maybe we need some more clarification on that.
Yeah, so I think moving out from the Appendix K, so July 1st, then the service, right, we will no longer have, I think, that overlap. We have the provision for dedicated supports for meaningful day services in the residential setting. So if that's the case, in lieu of day, what we talked about previously, there would only be one provider billing.
This one asks, can you confirm that high school diploma or GED requirement will be waived for respite and personal support services?
Yep. So as we noted on our charts, the services, it will be waived for personal supports. What was the other one, Nova? Respite. Yeah, and respite is also waived. It's not required currently in the waiver program. That's not a requirement.
This one's kind of. I'm sorry, just bear with me for one moment. Yeah, a lot of these questions I think have been answered. So I'm just going through because there's a number of folks who have interest here. So some of these, I'm looking through these questions, some of them have to do with the waiver renewal, and I just want to say that we will be having a webinar specific to the waiver renewal. So that'll be available, and you can answer more questions about that. This last question is staffing expectations. Are staffing expectations ending on June 30th?
Can you say that again, Nova?
I'm not clear, but are staffing expectations ending on June 30th?
Yeah, we would need more information. If you're talking about training, service delivery, implementing the behavior plan, I don't know what that.
Okay, this one just came in. Can an individual who receives supported living at his apartment and spends time on weekends with his mother, who is also his part-time staff, receive supported living at her house?
We're happy to take that back and look at that.
I think I'm going up and down this list, and it looks like we've answered most of these questions. Unless there are specific questions, we can reach out to those providers. We just give one more scan here, or if anyone has any additional questions, now's a good time to put them into the chat.
And just for everybody's sake, there are some questions that have been related to case management or others that I've been answering in the chat for all to see. So you can go ahead and take a look at those as well. But this will also be available when we have the FAQ that is applicable to this webinar.
Okay. You may have, this one asks, you may have addressed this, but why does Meaningful Day Services not get retainer days like residential?
Yeah, historically, we, in our waiver programs, we do not include retainer days. The Meaningful Day Services does include components in the rates related to weather days. And so we don't have retainer days.
Okay. Is training. This question has to do with training and materials available in Spanish. I'm not sure if it is specific training that this person's referring to, but I would say that if you need special accommodations or something in a different language, you can contact DDA, and we can certainly have that made available to you. This question, let me see if I can rephrase this.
I think the next question is a good one. There's a question about how to obtain a Medicaid number in ePrep. So you'll want to reach out to your regional office provider services staff who can help you with that ePrep Medicaid provider process.
What is this? For providers in LTSS self-directed services, is there a minimum requirement for Meaningful Day Services per week, year, or month?
Not for providers billing in LTSS.
There's some questions related to support broker services justification in the PCP for additional hours. I think that's kind of more in line with the waiver renewal process, but do you want to respond to that? Or?
Yeah, I mean, we've shared in our PowerPoint, our presentation today, that there are flexibilities for support brokers to get up to 20 hours now. So those flexibilities can be used. And then with the waiver renewal, there are several changes related to support brokers that'll go into effect July 1st that we'll be sharing in upcoming information and training.
Okay, thanks. If a person has ongoing job supports and works on Saturday and Sunday, can they still attend the day program Monday through Friday and bill for both services?
If any day allows them. Yeah, I mean,
Go ahead.
yeah, if ongoing job supports and works on Saturday and Sunday, then yeah, they could be supported in their job on Saturday and Sunday and also attend programs during the week up to the limits that's established, the 40 hours, unless it's ongoing job supports.
This is a question that just asks if DDA will be sharing information about LTSS, about participants viewing LTSS account. And I think the answer is yes. We will be sharing information outside of this webinar, just to answer your question. This just asks, is it up to 40 hours for each service, or is it 40 hours total adding all services?
Yeah, great question. So for the meaningful day services, once the Appendix K ends, they are limited to 40 hours per week, with the exception of the ongoing job supports to, again, support people who are working and may have overtime opportunities.
And just to add to that, you know, we've talked a lot about stacking, grading, and blending. So you can authorize multiple meaningful day services within your week and access them based upon your identified need in your PCP. So you could authorize, right, 30 hours here, 30 hours here, 20 hours here, 40 hours here, but you need to stay within the required 40 hours. And again, unless again, you're talking about the ongoing job supports that we've been talking about that can go above that 40-hour for folks that may be working overtime.
And I think this question came up a couple times. Do we have an anticipated date for when PORI will be updated?
So if we're talking about the PORI policy, I don't have any specific dates there. What I can tell you is the PORI training based off of the current PORI policy that DDA is creating that will be available for use, but it's not required to be used, will be available by June 1st.
It looks like we're getting some person-specific questions about unique situations for people and transportation challenges and attending programs. So please reach out to your regional office and they can help to work through some of those details and support you.
Yeah, I'm trying to go through. There's a whole bunch of questions and I want to make sure we don't miss any. I think we covered most of these.
No, but there was one that just came in about the CCs. Do CCS have the option to not attend PCP prep meetings? No, the CCS should be helping facilitate and coordinate the PCP prep meetings. That is their role. So it looks like the remaining questions really are specific to those meaningful day services, the minimum requirements, what's in PCIS2, what does it look like in fee for service. There's also some questions about the 250 days a year, 260 days a year. And like I said, we will outline all of that in a nice, clear, simple table, and we will make sure that that gets out sooner rather than later so that you all have access to that as you continue to plan with teams. In regards to those things in PCIS2, also be thinking about those of you that are transitioning to LTSS and the opportunities that exist with the transition to LTSS and the billing opportunities that exist there, the fee for service billing. I think there's some good reasons to start considering that transition and to looking at choosing a date to transition into LTSS in regards to looking at that fee for service model.
Yeah, and it looks like there was a question about the staff exemptions. I think that's staff ratio exemptions for providers. When do they end? They would end June 30th. And so as I think Nick has shared, it's important to have those conversations about staffing needs for people and working through all the opportunities that are available to support people and what's worked since those staffing exemptions were put into place.
I do see one question here. Can a person receiving respite residential attend their meaningful day program?
Yes, if they were in respite services in a residential site and they have meaningful day services, they could.
Now, there was a follow-up question to the deadline to transition to LTSS. So we communicated earlier this year that the quote-unquote deadline to transition is December of 2024. But I will tell you, do not wait until the very end. Start having conversations with your regional directors and regional offices now about choosing a month that you think is going to work for you, and it gives you the time to do that transition. I really will say, given the peers that have all gone before you and given the work that the regional offices are doing, it's really down to a science, and folks are moving through pretty seamlessly. So I would encourage you to start scoping with your regional offices as soon as possible.
Good point. There's a number of questions about virtual supports and in-person supports. Will folks be allowed to have a combination of virtual and in-person supports for personal supports and also meaningful day services?
Yes, absolutely. Again, that would be something that should be discussed and the person agrees to. It should be reflected in the service implementation plan, and the provider needs to have virtual supports approved as a program service plan, part of their business model. So you can follow it with the provider services to ensure that any supports you need.
And this one asks, as the policies are changing, will we be getting those policies before 7/1/23?
Yep, great question. So, yep, we're looking to update our policies with the renewal changes. Our goal is to get those out and share additional information in the coming weeks as we lead up to July 1st.
Thank you. Oh gosh. This one asks, some providers were previously approved for 260 days for DAHAB. Will that still continue, or with 250 days only be allowable?
Yeah, I think Nick had shared, we will be sharing additional information about that, and it can be reflected in that. So if you have person-specific questions, again, please feel free to reach out to the regional office so that we can work through and make sure we fully understand your question and what you're proposing. If you're proposing different service options under supported living and such, and the regions can help walk you through the current flexibilities and requirements.
Yeah, it appears that we've answered the questions. There's some duplicate here, and I know we're going to be working on some information, but looks like we've answered most of these questions. So I guess we can give a few minutes if anyone has any additional questions.
And just a reminder for folks, really great questions that came in today, and specifically around, the unwinding and the new waivers. And also some of the questions that were asked are really helpful questions that are also outlined in our waivers, our current FAQ. They're outlined in our policies. They're outlined in our on pages on our website and communication that have gotten sent out. So if there's still a kind of a lingering question, go take a look at those. And if you have a follow-up question, reach out to one of us. We're happy to pull the policy up with you and kind of look at it together.
Yeah, there's a number of questions coming in now. Can an individual receive respite and supported living services at the same time?
Yeah, we'll have to look up and confirm that in the waiver. But feel free to reach out to the regional office, just as Nick said. We can pull it up and walk you through it.
This question I can probably answer. It says, are there any changes with the family supports waiver? So there will be changes to the waivers starting July 1st, and we'll be having a webinar and providing more information about that shortly.
Yeah, and just to add to that, so the waiver renewal proposals that were shared and submitted to CMS and recently approved were for all three DDA Medicaid operated waiver programs. So the family supports, community supports, and community pathways waiver. And the changes that we've made are the same throughout. So if we made a change in assistive technology, it was made in all three waiver programs, so the same standards would apply.
And then there's a question about, there's so many changes. Will there be training for CCSs on the changes coming up?
Yep, we will be providing additional information as we noted in our next steps. We'll continue to talk about the unwinding, but we'll also be talking about the waiver renewal and sharing updated in our guidance and policies.
Yeah.
And I think just to build off of that, I want to be clear that things that need to be updated or revised in a PCP, we don't want everyone thinking that today you need to run out and schedule an in-person PCP meeting. Everyone sit around a conference table and work through this. Some of this stuff can be done through email. Some of it can be done through chats, a text, some phone calls, right? Some of this stuff, at the preference of the person, can be facilitated using technology that we've been utilizing and can continue to utilize. So please don't think that there needs to be a massive in-person team meeting for every single person. I think CCS, take a look at your caseloads, take a look at who you have that maybe some of these changes are going to affect, and start working with the providers, start working with the person, and start thinking about how does the person want me to communicate about these updates, these revisions, if applicable, and start moving through them. We're having this webinar today on 4/21. There's a good runway between July 1 to be working through these things. And I think as you start to look at them, you're going to realize that it's not going to be a massive lift. We've been slowly transitioning, right? And the flexibilities have been slowly transitioning over the last few months. And I think this is this last push around that. But I think you're going to find that it's not going to be a massive lift if we start planning now.
Yeah, great point, Nick. I do see a question about retainer days attestations and whether they're supposed to be done annually. I know on the website we've got the attestation forms for each fiscal year. Robert, did you want to address that?
Sure, thank you, Rhonda. Excuse me. Yes, I'll have to go back and work with the team to find out what guidance was given, 2 years ago or back prior when the Appendix K flexibilities went into effect, and then we can revert with that information.
I would just answer one question. There also seems to be a lot of questions about, are we going to make this webinar available? Absolutely. It's been recorded. It's going to be available. It'll be up and out, and I think it's on our YouTube page. It usually ends up in a couple different places. So yes, it will be available. If you have a hard time accessing it, reach out to the regional office, reach out to our training coordinators within the regional offices. You can reach out to Dr. Smalls. We'll make sure that you get a copy of it.
Yeah, and to that end, we'll also be combing through this and adding to our frequently asked questions too, so we can provide information there. I think we've covered everything.
Great, thank you, Nova. Bernie, would you like to offer some closing remarks?
No, I want to thank everybody for being here today. I think it's basically hopefully was helpful. Please continue to reach out to us if something wasn't clear. And again, thank you and have a wonderful weekend.